prone to inverting her foot when she does her leaps. So today I'm going to be putting on some stirrups to hold her foot in place laterally. Okay. So what I'm going to have you do is lift up your leg. Perfect. And I am going to test your CMS. Can you feel this? Good. Can you wiggle your toes? And they don't feel too cold, too hot. Okay. So first I'm going to put on some pre-wrap. So this is going to protect her skin from the tape when she goes to take it off and prevent any kind of irritation. So I'm going to go around her ankle like this. Just make sure I'm getting anywhere that the tape is going to be applied. Push her leggings up a little bit and then have her lift her foot just a bit. Going back down around her heel. And one more. And one more. Yeah. And then I'm just gonna tuck it in a little. Okay. Okay. And then, sorry, I'm gonna move this way to grab the scissors. And then the first thing I'm going to do is put on an anchor. I'm going to measure it straight the right length. That should be good. And then put that around her ankle. Just like that. Make sure with this don't put on any tension so she doesn't lose circulation in her foot. Next, I'm going to put on the first stirrup. So I'm going to measure from one side of the anchor and under her foot to the other side of the anchor. Sure it's the right length. Okay, and so since she inverts her foot when she does her leaps, I'm going to put the tension on the lateral side. So I'm going to first put it on the anchor. And what I'm going to do is just push up her foot and pull tight. Not too tight, but tight enough. Good. I'm going to do 2 more of these just to make sure it's nice and secure. So same thing, but I'm just gonna change where I put it just a little bit. Push your ankle up into dorsiflexion. Pull tight on the tape and smooth it out. And one last one. A little bit long. Good. And then last thing is I'm going to put one more anchor around her ankle just to hold all the pieces of the tape in place. Good. Perfect. And so those are her stirrups. So that, since the tension again is on the lateral side, it's going to help her from inverting her foot. So if she pushes up like this, it's going to help with this. Okay. Do you feel that? Okay. Can you wiggle your toes? And they don't feel too cold, too hot. Good. Okay. Now the other ankle. The other day, or today, she was doing a turn and she fell out of her turn too soon. And so that caused her to twist her ankle. And then when I was asking her about her pain scale, she said about a 4 or a 5, so I would say it's a minor sprain. And then when looking at it, there's a little bit of swelling and a bit of bruising, some instability when she's walking, and then some guarding, so some pain in her ankle. So what I'm gonna do is put on a figure 8 wrap, and this is just gonna help with reducing the swelling, help with a little bit of stability so that she's not causing any kind of further injury. But I wouldn't suggest she go back to dance right after. I would probably say stay off her ankle, continue to ice, take any kind of pain medication for a couple days before she starts walking again. So, I'm going to have you put this leg down and put this leg up. Lovely. I'll just so I'm going to go from medial to lateral, starting on her foot. Just going around, make sure it's up in flexion, in dorsiflexion. I'm going to go one more time around, up around her ankle, and then back down to do a closed basket. And then up, and back down to finish to close that basket. And back up, and down, one more time, and around. There we go. And then that's her figure 8 wrap. So can you feel your toes? Okay, and you can wiggle your toes. And they don't feel too cold or too hot. Does it feel secure? Tighten? Okay.